Hey everyone, welcome back to the Mass Retirees Weekly Update. Today's Friday, March 15th. I'm Sean Duhamel. Thank you so much for joining with us and tuning in again this week. Now today we're going to revisit a topic that we talked about not too long ago, back in November as a matter of fact, and the topic is turning 65 and more directly enrolling in Medicare if you're eligible, which for most folks, turning 65 triggers Medicare eligibility if you have enough quarters or if you qualify through a spouse. And we get more phone calls and outreach to our office on this topic than really anything else. It is really amazing. I think one of the reasons is that it virtually affects every single public retiree at some point, unless of course you're one of the retirees who don't qualify for Medicare. I'm going to talk a little bit about that in just a moment. But before I jump into those details, just let me thank those of you who attended our 3 meetings in Florida last week. Last week's video I filmed, of course, from the Elks Lodge in Largo. Right after we had wrapped up that meeting, we had jumped in the car right after that, drove a couple of hours up to the Villages, which is north of Orlando. We held our very first meeting on Friday in the Villages, and we had a fantastic turnout. We quite honestly didn't know what to expect because we had never been there before. But we had a fantastic turnout in the Villages. It was really the biggest turnout of the whole week. But all 3 Florida meetings exceeded our expectations in terms of turnout. So if you were a member who took the time to come out and meet with us and come up and say hello, thank you so much. We really appreciate it. We'll be back because of the turnout and the enthusiasm we saw from our members who want to see us in person and come to our meetings. So keep an eye on the newsletter. We will be publishing all of our upcoming Massachusetts meetings in the May edition of The Voice, which goes to press in just 2 weeks. You'll have it in early April. But with that, let's jump into the news of the week. Now, Medicare enrollment is even more important right now because of the fact that starting on April 3rd and running through May 1st, it's the Group Insurance Commission's annual open enrollment period. Now, open enrollment, and we'll be talking about this in the coming weeks and certainly in the May newsletter, but open enrollment is your one opportunity every year, if you choose to switch insurance plans or join the retiree pay-all dental plan or make changes to your coverage. If you are choosing to do nothing, that you're happy with your current plan, then there's nothing whatsoever that you need to do. You just sit tight. If there's a new insurance card, for instance, being sent out, it will be automatically sent to you. There is absolutely nothing that you need to do unless you want to change plans. And again, we'll be talking more about open enrollment in the specific insurance plans coming up. Now, one more point in terms of open enrollment in the GIC. On Friday, March 29th at 2 p.m., we will be holding a virtual teletown hall meeting. It's a Mass Retirees members meeting. This meeting will focus on open enrollment and specifically the Unicare, soon-to-be WellPoint plans. Unicare General Manager David Morales will be our guest. In addition to him talking about the change of name with Unicare to WellPoint and what's behind that, David will also be taking your questions and hearing directly from you if there's something relative to WellPoint or the GIC or healthcare in general that you'd like to talk to David about. So remember, there are 2 ways you can participate in our town hall meetings. One is by receiving the automated phone call from me at 2 p.m. that Friday. Which again is Friday the 29th. All you need to do is answer the phone, stay on the line, you'll be automatically connected to the meeting. The other way that you can join the teletown hall event is by calling the toll-free number that's published on the back of your Mass Retirees membership card. Now, we would prefer for you to answer the automated call. It is the most simple way the simplest way for you to connect. It's also the most economical way for us to provide the service to all of our members. So again, March 29th, 2 p.m., teletown hall meeting. David Morales from Unicare will be our special guest. But all of these things tie together. Now with Medicare, as I said a moment ago, we receive more questions and requests for help from members who are either enrolling in Medicare or their birthday is coming up in a few months and they're trying to prepare for it. So we get a lot of questions about this. So we thought it would be a good idea to revisit this again. Now remember, if you are eligible for Medicare and you are enrolled either through one of the GIC plans or through one of the local retiree health plans that exists, state law requires that you enroll in Medicare once you become eligible. That has been the law now in terms of for the state itself, for state retirees, since the early 1990s, and at the local level since about 2009. So we're going on, I guess, 15 years now at the local level and about 30 years at the state level that these requirements have existed. Now, if you do enroll in Medicare, you're not giving up your GIC insurance or your local Blue Cross insurance. GIC or Blue Cross, for example, will continue to provide the Medicare supplement plan and a Medicare Advantage plan if that's something that you've chosen to enroll in. So you're not losing your coverage. The biggest difference when you enroll in Medicare, of course, is the fact that the federal government is the sponsor of the Medicare plan. They're subsidizing and paying the lion's share of the costs associated with Medicare. Also, if you paid into Medicare while you were an active employee or your spouse did, in a way you've kind of prepaid for your retiree health insurance while you were actively working, and that's a key distinction between the non-Medicare versus the Medicare plans. So there are a few different ways that you can qualify for Medicare, and I'm not going to get into all of those details in this video. If you are a Mass Retirees member, the email message that comes out from us this morning will have all of this information in there. You can also find it, if you're a Mass Retirees member, on our website. If you're not a member, or if you're an active employee watching this video and thinking about retiring at some point in the foreseeable future, please consider joining with us. You can join by going to massretirees.com. The top of the banner has a link for retirees to join, but we also have an associate member program for those of you who are an active employee and you're nearing retirement age. We believe that our association and the information that we're sending out to you every week in our newsletter is an extremely valuable resource to help you in your retirement planning, and if nothing else, give you a little bit of an added peace of mind. So, as I started to say, there are several different ways you can qualify for Medicare. The most straightforward way is if you earned the minimum of 40 quarters on your own. Now, if you qualify for Social Security, you automatically qualify for Medicare. And again, it's the same 40 quarter or 10 years under Social Security or Medicare paying in that triggers eligibility. However, if you are a public employee hired here in Massachusetts after April 1st of 1986, you paid into Medicare as a public employee. You did not pay into Social Security, but you did pay into Medicare. Now, we have thousands of retirees who began working for the Commonwealth or a city or town or some government entity here in Massachusetts prior to April 1st of 1986. Unfortunately, you did not have the opportunity to pay into Medicare. Anybody hired before that date operated outside of both Medicare and Social Security. And that was a decision that was made decades ago. And when the change took place back in 1986, it was prospective for new hires only. So again, we have thousands of members, thousands of retirees who are not Medicare eligible. But if you are eligible for Medicare, so you have your 40 quarters, you turn 65, you then have to enroll in Medicare's Part A and Part B. That's it. We advise folks to begin the enrollment process in Medicare 4 or 5 months before your 65th birthday. It used to be about 3 months, but since the pandemic and the labor shortages at both the state and the federal government, and the private sector for that matter, things have really become bogged down, and you just want to make sure you give yourself extra time. Now, if you do not enroll in Medicare within 3 months of becoming eligible, the federal government will then assess a penalty for late enrollment when you eventually join. That penalty is 10% for each year that you're late. So if you join at, say, 66, it'll be 10% of the Medicare premium. 67 would be 20%. 68 would be 30%. That penalty exists throughout the rest of your life. There's no way around it. It's a federal law. It has been on the books since Medicare was first created in 1965. And while we believe that it's harsh, that's the federal law. And again, it's been on the books now for going on 60 years just about, and it's not going to change. So that's why we're getting this information out to folks, to protect you, to explain what you need to know in order to enroll in these different plans. So that's the most basic way. If you're eligible on your own, you enroll on your 65th birthday. Your spouse, if they're insured under your state or your local health insurance plan, when they become Medicare eligible, they also have to enroll. And the same thing with surviving spouses. Anyone who's enrolled in the GIC or a local health insurance plan who's eligible for Medicare has to join. Now, what about if you were a career public worker? Let's say you were a teacher or a public safety officer and you never earned your 40 quarters, either under Social Security or under Medicare by itself. Well, you can still be eligible for Medicare through a spouse. As long as you have been married or were married for at least 10 years, you could be eligible through your spouse if your spouse or former spouse is also eligible for Medicare or Social Security. That triggers eligibility. And even though you would not have a Social Security check to withhold the Part B premium from, you would still have to enroll in Medicare, and the federal government would send you a bill, a quarterly bill for the Part B premium that you would be responsible for. Now, we get a lot of questions from members who either are younger or older than their spouse, and one spouse may be eligible many years before the other spouse. You still have to enroll even if you are either younger or older. Once you are eligible for Medicare, you have to enroll in it. And in today's email message, we do get into the details explaining exactly how that works, and there's some nuances to it. So if you're a member, again, look to today's email message. We're not going to get into the details of any of that here or on social media. This is one of the benefits of being a member of Mass Retirees, is that you get the detailed information that you need to know as a public retiree. Now, the last thing I just want to mention about all of this is that once you are enrolled in Medicare, you would then have a Medicare supplement plan through the GIC or through the city or town that you have retired from. The benefits that are available, for the most part, and there's always going to be differences between insurance plans, but by and large, they're identical between Medicare and non-Medicare plans. However, Medicare enrolled retirees have a big advantage. You tend to spend less money, particularly out of your own pocket, for your health care because, again, the federal government is subsidizing that benefit. So the co-payments, the deductible pretty much goes away. The co-payments are much less. So it is really advantageous for retirees to enroll in Medicare if you can. Now, what about those of you who are watching this video or reading today's email message and who are not eligible for Medicare? You're over the age of 65, but you're not eligible. Well, there is a program, and we refer to it as the Medicare Buy-In Program, that allows the cities and towns as well as the state to buy the way into Medicare on your behalf. So the state, for instance, would pay any late enrollment penalties or additional fees that may exist because you did not pay in as an active employee and you never became eligible as an active employee. So at the local level, we now have about 40 municipalities that have proactively bought their way into Medicare for local retirees, and the local efforts have really been spearheaded by Blue Cross and Blue Shield of Massachusetts, along with the Mass Municipal Association through Maya. We have worked very closely with both entities on this front, and of the 40 or so communities that have now enrolled, we have not heard a single complaint from anyone. This has really been one of those rare instances of a win-win. Now, if you are retired from the state and you're enrolled under the GIC plan, you know that this is something that we have been advocating before or on behalf of at the state level for many years, and there are some very valid reasons why it hasn't happened yet. Primarily because there are 10,000 current retirees who are non-Medicare eligible, and all 10,000 individuals will need to have an individual application done on their behalf and their Medicare enrollment individually calculated. It is a big undertaking. And with the GIC's procurement process last year and ongoing improvements to its computer system and online portal, they have not had the opportunity or the bandwidth just yet to be able to implement this. But it is something that we're going to continue to advocate for, and we're very hopeful that the GIC can either have the enrollment process completed or at least begun prior to the next fiscal year, which would be FY26. So about a year and a half from now. So with that, I'm going to sign off for today. Again, if you want the details of this information, look to our weekly message. We'll have all that information included in there. But thank you so much for watching, and we will be back to you again next week. Take care, everybody. Bye-bye.